in really innovative ways. And then I'll talk about JED Campus as the underpinning or sort of the philosophical foundation to what we're doing. So in a moment, I'll talk about Trula, which is sort of an upstream strategy that we have in our state. I'll talk about the role of counseling centers within the system. We have an innovative after hours response programming as well at 3 of our institutions. And then Utah is very, very fortunate to have a crisis support line called Safe UT that started with elementary and middle schoolers and has since expanded to multiple populations. First, though, you're here for a JED convening, so I'll talk about what our experience with JED was like. So we have 16 institutions in Utah. It's a pretty unique system in that we have 8 degree granting institutions, so 2 and 4 year plus institutions, and then we have 8 technical colleges as well. Those used to be 2 separate systems, and they merged in 2020. We actually started the JED campus cohort with our 8 initial or original degree granting institutions. And then once legislation was passed to absorb the technical colleges into our system, we incorporated them into the JED relationship as well. And this was all possible mainly through grant foundation from the Marriott Foundation here in Utah. And what JED has done over the last 4 years, so we were in the cohort from 2020 to 2024, is each institution had their own campus sort of guidance and point of contact. We came together as a unit every year, but every quarter or so, we would have these folks checking in and doing foundational exercises in not only the assessment of how our students were doing. So I mentioned earlier the Healthy Mind Survey that was made possible by this partnership. But also engaged our campuses in strategic planning. So we're really fortunate to be well-resourced in the state, but we want to know how to make all of these resources work together more efficiently and more effectively, and how do we build upon those things that we're delivering the best care and creating the best community possible for our students, staff, and faculty. And our JED campus cohort would walk us through implementation of these strategic plans, evaluation, and then at the end of the 4 year cohort, really worked with the campuses to figure out, you've made this progress, now how do you sustain that moving forward? And I'm going to start with talking about the positive impact this had on our campuses and their practices. And then at the very end, I'm going to bring that back to what that translated to for our students. So what impressed me the most, and you'll receive this as well at the end of your cohort and your engagement with JED, but we had sort of a cohort and post-cohort assessment of how our institutions were doing and the changes that they made. And the 3 takeaways for me that were so important was, one, over 70% of our institutions strengthen their infrastructure for collecting data on mental health, which I think is important. We need to have that finger on the pulse of how our students are doing. But then they also improve their ability to couple that data with the outcomes that we as a system are really looking to improve, right? That we have a statutory obligation to improve. And that's how are students being retained in higher education? How are they faring academically? And how are they advancing to degree or certificate completion that's going to improve their quality of life and the quality of life for their family? More than 70% of our institutions also enhance their well-being, health promotion, and life skills education and programming. And this is really important to me because we'll talk about some of the tremendous resources we have in the state around crisis intervention. But I know as much as you do, we need to start shifting our focus into how do we prevent crises from happening in the first place. So to see our institutions really bolstering that wellness education and promotion and activities was really exciting for me. And then lastly, nearly 70% of our institutions developed formal processes for identifying and improving support for students who are flagged as at risk for isolation or disconnection. So really that ability to predict or to pick up on cues that a student needed additional support was excellent outcome for our institutions. So I'll talk about the 4 programs that I mentioned earlier. So I'm going to start with Trula. So this is a program that was homegrown in Southern Utah in St. George, and we have funding from our legislative partners to implement this across all 16 campuses. So Trula provides in-person or virtual peer coaching to help students develop life skills, academic skills, work with their stress management, their time management, and really all the skills that are necessary for a student to be successful in higher education, which can be really challenging for a student, especially if they're coming right from high school and they've never been in this setting before. So this is really more of a peer-to-peer solution of how do I feel like I have somebody in my corner who gets it, who's in the same boat as me, they're a college student as well, and somebody that I'm comfortable talking to about these challenges. And in the first semester of this academic year, so I believe this is our fourth year with Trula on our campus. Oh, sorry, did I hear a question?
You're good.
Okay, perfect. So I believe this is our fourth year, and in the first semester of this academic year, so fall of 2024, we had over 6,000 students who were participating in the peer coaching, and 86% of those who participate report that they're feeling better equipped to face the challenges that come along with being a college student. And then counseling. So we have 9 of our 16 institutions have a dedicated on-campus clinical counseling center, and 8 of those are our degree granting institutions. So it is a little bit more challenging for a technical college that's smaller, usually has a smaller budget, to be able to prop up something like their own counseling center. But that's why many of our other institutions either partner with somebody in the community as their standalone resource for getting students mental health counseling opportunities, or they'll do that. Some of our institutions do that alongside their counseling center to increase their capacity to be able to help students. And then the after hours programming really started at the University of Utah with MH1, which is mental health first responders. So this was an innovative approach by Dr. Torrance Wimbish, who was seeing this need for residence halls response, right? If there's a crisis that's happening, it's usually after the counseling center is closed, students don't know where to go. And so it was this idea that we're going to start here in the residence halls of the University of Utah and have a crisis response team who can help with mental health crises. So seeing that as a really innovative approach, the legislature invested ongoing money to help prop up the programming at the University of Utah and then expand it to, they had enough funding for 2 institutions in the state. So we were really strategic about who we chose, and that was Southern Utah University and Utah State University. So we have 2 rural communities in this situation as opposed to University of Utah's in our urban center of Salt Lake City. We wanted to see how could that proof of concept kind of work out in a campus that's very different. So with that ongoing appropriation, these institutions were able to prop up their programming as well. And it's really transformed from not only crisis response and support, but also just like how do we leverage that time between 5 p.m. and maybe 10 p.m. when students are trickling back into their residential communities. The counseling center is closed, but they might need some support. So they've expanded beyond just crisis response into things like stress management classes or group therapy sessions as well. So our University of Utah and Utah State University partners only serve their residence halls, and that's from capacity. But Southern Utah University is a really small community, and actually not many of their students live on campus. So they serve students who are either living in the residence halls or in the community outside of campus as well. And then the one I really love to talk about, and usually the one we get the most questions about from other states, is Safe UT. So this was an app and a website, but most folks use it through the app, that was created by the legislature back in 2015 in response to some of the mental health crises that we were seeing in youth population. So it really started for middle and high school students, and it's twofold. It is real-time messaging 24/7 with a licensed a master's level licensed counselor. And that can either be through like texting through the app, or you can physically call that person as well. And there's also a tip line. So if there's a situation where a student says like, hey, I have a friend who has expressed suicidal ideation, I really want some intervention and some help for them. Or I've heard that somebody's bringing a weapon to campus or has made these threats to campus, then there's a tip line for support as well. So it began with middle and high school students. It was later expanded to elementary and post-secondary education, and we were very lucky to have been brought into that fold. And now it's been successful enough in education that they've expanded it to other populations that need some additional support and that the data says are struggling more with mental health. So it's expanded to Utah National Guard, Utah first responders, so really fire and police. And then we were seeing a need for that in Department of Corrections as well, and those who work within our jail and prison system. And it was expanded, I believe, a year ago to that population. I've linked to their annual report, but one thing that I think is really impressive is last year, it was their 2024 annual report. So in 2023, either through tips or through chat, they were able to intervene and deliver 536 life-saving interventions, sometimes with the help of first responders as well, to prevent those who would have attempted suicide. And then across all education, to give you an idea of how this is utilized, so from kindergarten all the way through post-secondary, there were 26,000 chats initiated, and that amounted to almost 1 million back and forth messages in 2023. So I want to kind of put a bow on this by talking about some of the challenges that we've faced as we've advocated for additional resources or tried to implement these resources, and how I think that might help you as a system as you engage in your journey with the JED Foundation. So the first one I think for us is develop a compelling argument as to why mental health is in your purview as higher education leaders. So this is a conversation we've had to have time and time again, is there's resources in the community. Why do we have to be all things for all people in higher education? And, when it comes to lawmakers, that's a fair question to ask, right? They have to make sure that they're being uh, prudent stewards of taxpayer dollars. So what we always bring it back to is our statutory obligation as a system. So I'll read this from Utah Code. The Utah Board of Higher Education shall establish and promote a state level vision and goals for higher ed that emphasize data-driven retrospective and prospective system priorities, including quality, affordability, access, completion, workforce alignment, and preparation for high quality jobs and economic growth. So our argument is really this: we have our marching orders, so to speak, from the legislature. It is very clear in statute what we are responsible to do as a system. But we also have the data that's showing the things that are preventing students from coming to us in the first place, and the things that are preventing the students from successfully completing their degrees. It really does boil down to mental health in a lot of circumstances, and increasingly so over the last decade. And while we do respect and appreciate that there are resources that exist in the broader community, we know that there are still gaps in students being able to access those things. And if we are their touch point to government, to institutions, and we can start providing some of those things and filling in those gaps, and ultimately it helps us deliver on this obligation, then that's why it's within our purview. And I think bringing it back to that core mission of higher ed has really been successful for us. Lesson number 2, embrace telehealth, but anticipate that the conversation is going to be nuanced. And I'm not sure where you're at in this conversation in your state, but as I mentioned, 9 of our 16 institutions have counseling centers. Not every institution is able to prop up a standalone resource like that. And so we've had a number of conversations over the years, and we've encountered a number of fears or perceptions or challenges as we've continued to have the conversation. So I noticed back in 2021, 2022, the sentiment around telehealth, mental health therapy, was there was a fear that it was going to replace or displace the role of the campus counseling center. Understandably, those folks were saying, we know our populations better than anyone. We are the resource they need to turn to. Please don't pivot away from us and toward telehealth therapy. There were concerns, and I think there continue to be concerns about safety and ethics around AI in telehealth care and chatbots and the use of these things. Utah actually has a broader law that was passed in this session that addresses some ethical concerns with AI and mental health more broadly. And then the third concern or perception we were hearing is that um, there is an opportunity for cost savings, right? If we can all come to consensus on what kind of vendor we want to use or enter into a joint contract. But a continued challenge for us is having institutions reach consensus on what vendor they want to use so that we can capitalize on those economies of scale. So I've noticed over the years that more and more of our institutions are actually starting to supplement with telehealth therapy, or in the case of some of our technical colleges, use it as their primary resource. And I think the winning arguments were this, as I was seeing this community engage around this topic. One is demand, right? We just can't be all things to all people. We can't hire enough mental health counselors on our campuses to be able to fill the capacity. And there are, of course, budget restraints, even if we could find those folks to fill those roles. Another one is we're increasingly commuter campuses, right? So we have to be able to accommodate those students who aren't living on campus, whose schedules, whether that's around school or work, don't necessarily fit tidily into an 8 to 5. We need to be able to meet their needs as well. And then a really compelling one as well is that we need to open access to students who aren't physically in the state. So whether they are studying abroad for a semester, or maybe it's a student athlete and they're on the road every week, they need to have access to care just as much as if they were sitting right next to us, right? And because our counselors are only licensed to practice in Utah, that presented some constraints that really only virtual telehealth therapy could resolve. And then lesson number 3, This one's going to sound Pollyannish, but I love to talk about this. And that's the upstream approaches can be simple and elegant. I don't want you to read that as easy because they're not, but they can also be effective. And I think one really cool thing about Utah is we have a tremendous focus on service and volunteerism. So, whenever folks talk about Utah, like our governor, Governor Cox, he'll talk often about how we'll get ranked as the highest quality of life, or we'll get ranked as the best growing economy. But time and time again, we hear this survey from AmeriCorps that shows that Utahns, our state is number one when it comes to the number of volunteer hours per capita. So we're number one in volunteerism. And we're really proud of that, but we want to make sure that we're investing in ways that make that accessible to everyone and to keep that spirit of service and volunteerism alive in the state. And so I want to talk about this One Utah Service Fellowship that was passed in the legislative session last year and really spearheaded by Governor Cox and Lieutenant Governor Henderson. So this is an opportunity for youth in Utah, young adults, to provide a year of service. They receive a living stipend. They receive, I believe it's a $7,500 tuition award if they're serving full time in that year. In the year that they're serving, they're working with our system to try to find opportunities to align this to career opportunities, to get credit for prior learning for some of their service, to get help with admissions or FAFSA questions if college is their next step, which is the intent of the program. Or some of our students are serving part-time in that year and going to school part-time as well. And in this first year, we had 619 young adults serving across 294 sites. And more than half of those young adults are actually serving part-time while going to school. And the reason I bring this up is going back to, we're really well resourced. We have these programs that work well together. We're fortunate that our legislature has invested a lot in mental health, but we're also fortunate that we have a yes and approach, right? And so when we saw those startling trends that I talked about at the beginning about disconnection, about isolation, about not feeling a sense of belonging or purpose or meaning, this is an opportunity for students to engage with their community, to find that sense of belonging, to narrow that sense of isolation in a way that not only helps themselves, but helps their community at the same time and presents opportunities for their future college and career prospects as well. So I think that this is an example where, I almost debated whether or not to put it in, right? Because this is not outright a mental health initiative. But if we connect the dots on the back end, we can see how this can help with some of those things that our students are reporting. And it can be a good upstream solution to isolation. So lastly, I mentioned I would bring up some of our student outcomes from the JED Foundation. And these are the ones that I thought were most prescient to bring up because ultimately, what I care the most about is that students know how to resolve an issue or how to get help if and when they do encounter challenges, even more so than I care about the data on the perceptions of isolation or stress or anxiety. I think the most important thing is they exist within an ecosystem where they know that they're supported by their institution and they know where to go when they need that help. And so what we saw from the yellow is when we did the Healthy Minds survey at the beginning of the program, and the blue is at the end of the cohort with JED. So our students, you can see, had better answers when it came to, at my school, I feel that mental and emotional well-being is a priority. At my school, the administration listens to concerns when it comes to health and wellness. The campus climate encourages free and open discussion about mental health. And then most importantly, if I need to seek professional help for my mental or emotional help, I know where to go on my campus. And all of those saw a pretty tremendous increase over the last 4 years. So with that, I will also make my slides available if you want to deep dive into, that basic needs survey or some of the data around Safe UT or any of those things. I'm also available offline if you want to engage about some of these programs, but I'm here for the next few minutes as well to answer any questions that you might have.
Katie, that was fabulous. Appreciate all of your, okay, thank you. That was fabulous. Thank you so much. And really appreciate you talking about your wins, your learnings, your the future focus. And I was particularly interested in the challenge of reaching consensus, because that's what we have to ultimately do. How do we prioritize, make sure everybody has a voice, land on the thing, do it. So thank you so much. Anyone have questions to start us off? Katie.
Can I just touch on what you were saying about consensus just
Sure.
now?
That's a question. All right, that's our first one. All right.
Okay, that's your first one. Made it into a question. I think another thing we've had to accept is that consensus among 16 institutions is probably never going to happen. And so we can't measure success as like, hey, we found a shared service and we got a contract that's system wide and it's clean and it's tidy and we're done. But maybe what we can consider success is incremental progress along the way. So an example of that is like 5 of our institutions are using Timely Care, Timely MD. And so they're exploring just like what would it look like to have a shared contract with 5 institutions, with some flexibility for other institutions to jump on if they ever chose to. And so, maybe you won't reach a point where folks are like, yeah, I'll abandon my vendor and adopt this one, or and that's perfectly fine. We want our institutions to have that autonomy, and maybe just economies of scale in small clusters is a good way to approach it at first as well.
Yeah, you have a question.
It sounds like the Utah State Legislature has been a tremendous ally in all of this. And I was just wondering if you have anything to say about how it got that way. Like, how did that become important?
Yeah, I think I can't speak to maybe the entire kind of journey that the legislature's been on, but I think I've had a front row seat to Safe UT. I used to serve on, they're run by a commission, and there's multiple stakeholders from across the state that are on that board that directs that. And so I've had a front row seat to the 2 legislators who were really the parents of that program. And that's Representative Steve Elison and Senator Dan Thatcher. So I think for us, Utah and the Mountain West in general have, for the last 10, 20 years, mental health has been at the forefront because we've seen increases in suicide in the Mountain West states. But I think when you have like individual allies, right, you might not have the whole body behind this concept of mental health as a crisis or an inflection point. Or you might not have broad consensus on what the resolution looks like. But I think if you have 1 or 2 folks in the legislature who are close to the issue, who have constituents who are talking to them a lot about it, and who come to the table with innovative approaches, it can go a long way. So in my mind, or at least from my perspective, those 2 legislators in starting Safe UT early on in 2015, so almost a decade ago now, having them as champions talking about this every year was something, especially when it came to children, right? And we want to protect our kids, and every state is like that. But when you really start bringing it home and make it an issue where it's affecting the youth, I think that's where it started to catch on and get a lot of momentum. We also have just, it goes back to the people in charge, right? Like we have Department of Health and Human Services within the governor's cabinet. The woman who's in charge of health and human services in Utah is a force to be reckoned with. She's an absolute powerhouse. So I think, we've had some really strong allies who have brought this issue to the forefront, and that's been really important in advancing this work throughout our state.
Other questions?
I was curious to hear more about Trula and how students are referred to that and how the peer coaching is managed.
Yeah, so that's a great question. So I'll start with the last question, how it's managed. So Trula has it, I mentioned it's homegrown in Southern Utah. So they have their corporate office down in St. George, and they have a team of folks who will work with it's mostly our senior student affairs officers at the institutions to recruit those peer coaches. And then they're paid for their work. They're managed through the staff at Trula. But it's through those SSAOs and those VPs of student affairs that we really have a marketing campaign from Trula that's like custom built and ready to go. So they do social, they do flyers on campus. So some of our coursework, right, at the institution have partnered with Trula, especially when it comes to like social work professions. They have partnered with Trula and said like, hey, we really want our students to be able to leverage this as sort of an extracurricular activity. It's good for building their skills for going into this workforce. So sometimes they'll refer them to Trula to be peer coaches. And then the rest is really like, so some of our institutions have like a introduction to college course where they're taking that in their first semester on how to be successful in a college setting. Sometimes Trula is introduced to students through there. Mostly it's not like assigned or required. It's usually like an extracurricular or excuse me, an extra credit opportunity. So it's a little bit of everything, right? Like sometimes we're getting at the peer mentors and we're getting at the prospective students who would use the service through the classroom setting, the curricular setting, and sometimes we get to that through just a traditional campaign around awareness on campus. And that's really where our VPs of student affairs and their partnership is crucial.
I have a question. I was curious if there are any communities or social groups, say low income students, students of rural backgrounds, first generation students that have been particularly difficult to reach with resources, or that there have been struggles trying to keep up with these resources? And if so, how have you been navigating that in order to make sure no student is left behind?
Yeah, the first one that comes to mind, and you mentioned it in the list, is rural. So we have, a couple of our institutions. So to kind of paint a picture, we have University of Utah and Salt Lake Community College here in Salt Lake City, which is a huge metropolitan area. And then we have some of our four-year institutions like Southern Utah University, Utah Tech University. They're in small yet growing communities of, let's say, like 25, 30,000. So small, but not completely like rural as you would think, right? But then we have institutions like our Uinta Basin Technical College that exists in Vernal, Utah, like remote Eastern Utah, very, very small populations that they're serving. So we kind of have the gambit of like where our institutions are at, how isolated they are in terms of services in their community, and that's just the result of distance, right? And so what we've really tried to do, so the telehealth opportunities are one where we're trying to address that. So I'll give you an example of SUU. So I mentioned, expanded the after hours programming to Southern Utah University. And out of all the degree granting institutions, that was sort of the first one that came up because Cedar City, where SUU exists, very small population, they actually don't have a mental health receiving center. So if there's crises on campus and a student needs to be brought to an institution, they actually have to drive like an hour south to St. George. It's also very hard for those communities to recruit and pay competitive wages for licensed clinical social workers, for mental health counselors. And so what we're seeing there is like we're really lucky to have the folks that we have on those campuses who are in those professions, but we can see the writing on the wall that like we're just not recruiting in the workforce that we need to be able to sustain that physically in person as a service. So that's where again the telehealth therapy came in, but also just that opportunity when the legislature does invest to try to prioritize our rural communities in those expansion opportunities more so than our Wasatch Front partners.
Oh, yeah. Would you be able to talk more about the after hours programs?
Oh, yeah. Could you talk more about the after hours program?
Yeah, definitely. So as I mentioned, it started at the University of Utah. So they have Dr. Torrance Wimbish there, and he has a couple folks on staff who work mainly on call, but there's always somebody in that office. I believe their hours are from 8 to 2, 8 p.m. to 2 p.m. That's where it really started is, we've got this kind of advertising campaign in the residence halls. Like if you are ever in trouble, if you ever need support, here's who you call, right? This MH1 is what they branded themselves as. And so that's where it started, expanded to Utah State and Southern Utah University. But with those campuses, what we were seeing is, we really want to prove to the legislature that this funding is being used in the best way possible. So it continues, right? Everyone's legislative strategy. So what we were seeing in those campuses is yes, there's absolutely a need for crisis intervention for them to be able to respond. I mentioned SUU does that in their residence halls and in the broader community because they're such a small community. Utah State just sticks with the residence halls. After that first semester, we were seeing like this is an important resource and the crisis intervention is key. However, there's a lot of downtime, right? There's a lot of opportunities for these folks who are either staffing that after hours or who are on call to be able to engage in other creative ways and to supplement what's happening during that 9 to 5 traditional time. And so at Utah State University and SUU, and now University of Utah as well, has started this in that downtime where it's like, all right, it's just after folks are starting to eat and trickle back into their rooms. They are starting more wellness activities. So they're starting stress management courses. Over the last year, they started group therapy sessions as well. even just like drop-in hours, right? So it's like if you have a situation where you want to talk to somebody, but the counseling center office hours are not working for you, you can actually drop in, or there's some situations where you can make an appointment as well. So like I said, evolve from crisis response to being more of a holistic approach to mental health and well-being at those 3 institutions.
2 more questions.
Yep.
Okay, I'll throw a question.
Okay.
So Katie, we are spending our time together. You know, we have our statewide strategy. You saw it. You saw it in on the PDF we sent you. And we have 4 pillars that we're focused on: student engagement, faculty training, crisis response, intervention, and communicating the work. So we have to prioritize together today and in the future. So what advice do you have for us? What do you wish you had that you didn't have? What did you take that you had that you want to share with us? Some of those lessons for us.
Yeah, I would say, I'm trying to think back, and I don't know how many details to share about this. So in a JED convening, I believe in 2022, as a unit, we were talking about, so we had all of our campus contacts and sort of the leaders of that JED relationship. And we had an hour or so where we said, we have a lot of support from the legislature. Let's capitalize on this and let's help the board put together a request for funding moving forward. And so we spent an hour and we talked about like, okay, here we asked for, I think, 1.5 million that year around telehealth. And it was another 1.5 million for, we called them resource navigators. So we saw in that data from the basic needs survey and Healthy Minds that there's a really strong correlation between basic needs and security and mental health challenges. And so we thought, okay, let's deploy some folks on the ground and let's have them, you know, as sort of a one-stop shop for, you know, signing up for SNAP, signing up for WIC. Do you need to be connected to childcare grants? Do you, you know, all these things. If you need help finding a counseling center, they can sort of be that central point. And so I think for us, it was a big lesson learned, right? Where we came together, we had this request, and it was in a particularly lean tax revenue year, and it didn't get funded. Not because it didn't have support fundamentally or philosophically, it was because like literally there is this much of a pie to divide among all institutions, and that just wasn't the priority that got funded that year. So I think a good lesson for us too, and in the couple years after that, our institutions and our office were really more reflective on prioritizing like what can we do with the resources that we have rather than trying to capitalize on the momentum and develop more. Maybe we should have been a little bit more introspective before that ask and read the room, so to speak, in the tax revenue situation. So for us, I heard one of the priorities in that list was faculty engagement. That was something that our cohort really shifted toward looking at as well, is what is the role? You have this captive audience, so to speak, of faculty members who are face to face with these students every day in a way that other folks on campus are not. And so how do you really start tapping into them and being able to train them on identifying when a student is starting to struggle academically, what might be going on behind the scenes? I know I don't have a ton of time, so I won't go too much into it. But Utah Valley University, if you ever have an opportunity to look into them, I think is the like bellwether of how this all worked in the system. So they have not only that faculty training to be able to identify when a student is struggling, but they've actually sort of coalesced all their resources into what they call a care hub. So they refer a student who might be, you know, facing academic probation, for example, to the care hub, and then they sort of triage like what actually is going on. Is it mental health support that you need? Is it, we've got the food pantry, we've got on-campus childcare, you know, what is more broadly causing this this challenge, and how do we address that holistically to make sure that you have the resources you need to be successful? So I don't know if that answered your question, but to me, it's, you know, we found opportunities to be more introspective and to utilize the force that you have on campus and faculty as a force for good in the mental health, student mental health space.
That was great. So Katie, it was wonderful having you. Thank you so much for sharing your wisdom We're so glad you're still part of this work. We're gonna keep learning from you, keep kind of connecting with you, and I hope those in the room connect with you offline as well if they have other questions. But really, thank you for your time and for the work you're doing, your painting.
Well, thank you all. I appreciate it.
Thank
Have a
you
good
so
day.
much.